Professor Jane Pirkis is one of Australia's leading experts in suicide prevention research. As Director of the Centre for Mental Health at the University of Melbourne, Jane has conducted a large number of evaluations into suicide prevention initiatives and mental health programs.
There is sometimes a perception that suicides are never reported, and there's also a perception that guidelines that have been developed to encourage responsible reporting are about censorship. But both of those things are actually not correct. So there is reporting of suicide. About probably 2% of Australia's suicides are reported. And the guidelines that are about responsible reporting of suicide are all about doing so in an appropriate way that's helpful, that educates the public, not in a way that runs the risk that people might copy suicidal acts. We were fortunate to get funding from Australian Rotary Health early on in the 2000s, in about 2001, and we did a project then that was a small project but an important project, which did indicate that this copycat phenomenon that I've been talking about exists, and that work has led to numerous other grants from other funding bodies to build up the evidence in the area. The copycat phenomenon is well documented. There's good evidence for it from numerous studies around the world. The theory is that people copy behaviour of others who they either revere or they see as similar to themselves. So, for example, celebrity suicides, which are ones that are likely to be reported, are perhaps particularly ones that need to be reported carefully, because people really do revere celebrities and want to be like them, want to copy their actions. Most of the work that I've done has been in the area of traditional media. I think social media are like traditional media in the sense that there's the potential to do harm, but also the potential to do good. So people seek support through social media. People learn things through social media, but potentially they can also make connections with people they might not otherwise have made connections with, who might influence them in ways that we wouldn't want them to. So I think the guidelines are still very relevant for traditional media. Social media is much harder because anyone can contribute to and consume social media. There's often discussion in the suicide prevention world about what the equivalent of those guidelines might be for social media. The funding from Australian Rotary Health was crucial in developing this whole area of research that really has become my own area of research since then. So for the last 15 years, because of the funding from Rotary at the beginning, it spawned a whole range of other studies that allowed us to answer some questions that at that stage had been unanswered in this area of suicide in the media. Rotary Health support is really important for continuing that research. So one of the great things about Australian Rotary Health is that the funding is often given to projects that might not be funded through other funding bodies like the National Health and Medical Research Council, but the projects are great projects. So they're innovative, they're sometimes maybe there's a bit of risk attached to them. They might or might not work, but some really good things have come from them. And I think there are probably multiple examples like mine where a modest amount of funding from Australian Rotary Health has spawned a huge area of research that has really advanced knowledge.